Hello and welcome. Today we're diving into something that's bringing a whole lot of new hope to a condition that for way too long has just been a journey of watching and waiting. We're talking about a brand new chapter for dry age-related macular degeneration.
So, if you or maybe someone you love has gotten that diagnosis of dry AMD, you know exactly what I'm talking about. You know that feeling of uncertainty that comes with it? I mean, it's a diagnosis that changes how you see and experience the entire world around you. And for so long, the standard approach has been, well, honestly, it's been pretty frustrating. It's meant monitoring your vision, taking supplements, and basically just waiting as things slowly get worse. It's like you're a passenger in your own vision health, and that can feel incredibly powerless.
But what if I told you that story is starting to change? We are now at a point where watching and waiting is no longer the only thing you can do. There's a new treatment out there that isn't just about slowing things down. In many cases, it's actually helping to restore vision that's already been lost.
So let's just quickly touch on that old story. Dry AMD has always been such a challenge. The options were really limited, right? Manage your lifestyle, take certain supplements, and have your eye doctor just track the slow, steady loss of that all-important central vision. Well, this is the turning point. This is where the story shifts. The arrival of a treatment called MacuMira is changing the entire conversation. We're moving from passive monitoring to active improvement, and this is all thanks to some really big recent milestones. And this right here shows you why this is such a game changer. First, you've got official approval from Health Canada. That takes this treatment out of the experimental phase and puts it right into mainstream care. That's huge. Second, access is expanding like crazy. It's already in over 150 clinics. And maybe most importantly, its safety record is rock solid. We're talking no device-related adverse events reported. Put all that together, and it signals a massive positive shift for patients. Okay, so how does it actually work? It might sound complicated, but the science behind it and what it's like for the patient is surprisingly simple. Let's break it down. At its heart, MacuMira uses something called retinal microcurrent stimulation. Now think of it like this. It sends a super gentle, low-level energy through your closed eyelids. This energy helps to kind of recharge those hardworking cells in your retina, boosting their function and their health. It's not a drug, it's not surgery, it's all about stimulating your body's own cells to just work better. The way the treatment works is really structured. You start with what's called a loading phase. That's 4 sessions packed into about 10 days to really get things going. After that, you just switch to a maintenance phase. That's only 1 session every 3 months or so, just to keep those great improvements going strong. And a session itself? It's designed to be super simple and comfortable. This is completely non-invasive. We're talking no needles, no surgery, none of that. You just sit back with a headset placed over your closed eyes for about 32 minutes. Some people say they feel a little mild tingling or see some faint light patterns, and that's totally normal. It's just a sign that the stimulation is doing its job. Okay, so the process is simple, but the big question is, does it really work? Let's get to the good part, the evidence. Let's see what the clinical trial data actually shows, because this is where things get really, really compelling. And this slide just lays it all out, plain and simple. In a 30-week study, the folks getting the MacuMira treatment gained, on average, 8.2 letters on a vision chart. That is more than a full line of improvement. That's a change you can really feel in your daily life. Now look at the other side. The group that got a placebo, they actually kept losing vision, about 2 letters on average. The difference is just undeniable. And get this, nearly half, 48% of the patients treated with MacuMira gained 10 or more letters. That's 2 full lines on the eye chart. This isn't just a little tweak. We're talking about a significant, meaningful improvement to your sight, the kind that can impact everything from reading a book to recognizing the faces of people you love. You know, the data is one thing, but the experience people have is another. And what's so amazing is that many people say they notice a difference really quickly, often right in that first 10-day loading phase. They'll talk about better contrast, colors seeming brighter, and just overall improved clarity. All right, now with all of this exciting information, it is so important to talk about who this treatment is really for and to set some realistic expectations. It's not a magic wand, but it is a powerful tool. So a great candidate is someone with a confirmed diagnosis of dry AMD, especially if you're in those early to intermediate stages. It's also key that you can commit to the treatment schedule. But on the other hand, it's just as important to know the limitations. This is not a cure for AMD, and it absolutely cannot treat the wet form of the disease. And, of course, while those average results are amazing, everyone is different and individual results will vary. So, if this is all sounding like it could be for you, what's the path forward? What do you do next? Let's walk through the simple, clear steps you can take to find out more.
First things first, and this is the most important, talk to your optometrist or your ophthalmologist. Confirm your diagnosis and figure out what stage you're in. Step 2, ask them about MacuMira. With over 150 clinics offering it, there's a good chance they either offer it themselves or can refer you to a clinic that does. And finally, step 3, have a really open, honest conversation about what realistic goals look like for your specific eyes.